good afternoon, everybody. And thanks for joining us today for Superior Health Quality Alliance Nursing Home Leadership Roundtable, where we continue our series that we've been hosting this year on turning your deficiencies into efficiencies. And today we are going to hear from Sharon about health equity for people with disabilities and their families. I'm Tabitha Meyer, a Quality Improvement Advisor with Superior Health Quality Alliance, and I'm accompanied today by my colleagues Margaret and Constance, who will be monitoring the chat and providing you with any of the links that we refer to or talk about, as well as our guest speaker, Sharon Milberger. We have been hosting these events twice a month for a couple of years now, and this, I'm sad to say it's coming to an end, and this is our second to the last roundtable event we'll be hosting. And as a reminder, the first half of the call the first majority of the call includes informational presentation, while the last minutes of the call will be saved for discussion and Q&A. The link for the presentation will be put into the chat momentarily, so feel free to click on that and follow along if you'd like. And we do love hearing from everybody on the call, so please use that chat box when you want or when you're able to share any comments, questions, or resources that you've used. Share anything that's worked for you related to the discussion, because besides learning from our speakers, we also learn from each other. So that's why we're all here. And toward the end of the event today, we'll also put an evaluation link in the chat that will only take a couple minutes to complete. So we really encourage you and thank you for filling that evaluation out. It's super valuable, and it helps us kind of pivot and meet your needs to give you a better experience. So we'll jump off today by sharing some timely information about immunizations and some recent guidance on reporting data. And I will let you go ahead, Constance.
Hi, everyone. I just wanted to take some time to talk to you about a couple of different things. We wanted to let you know the new 24-25 COVID vaccines were approved. They're now at pharmacies across the country, and they will be receiving them soon. Some additional information about those vaccines and options and manufacturers. Pfizer and Moderna were both approved. They are mRNA vaccines, and both of them target the KP2 strain. Novavax was also approved. It's a protein-based vaccine, and it targets the JN.1 variant. It is of note that people who have had particularly adverse response to the previous mRNA vaccine might want to consider the Novavax vaccine as an alternative, because as a protein-based vaccine, it generally doesn't have as strong of side effects. Some common questions we might have about Novavax is you can still get it if you previously got Moderna or Pfizer. As long as you're 12 years of age or older, you can get the Novavax vaccine at least 2 months after your last previous dose. Some pointers to improve staff and resident compliance. If they're tired of hearing about COVID vaccinations, it's important not to, one, call it a booster. The updated vaccines are new information for their bodies, so letting them know that information provides the best protection from COVID-19 and protection decreases with time. We're reminding them that much like the flu, new strains of COVID virus continue to appear from one year to the next. So as with the flu shot, it is recommended that you receive an updated COVID vaccination to help protect themselves. The CDC recommends that everyone ages 6 months and older receive an updated COVID vaccination. The vaccines are still among the best tools we have to reduce the severity of COVID infections. If you recently had COVID infection, you could wait up to 3 months before getting the new vaccination, as your immunity is already high. If you received a COVID vaccination recently, you could again wait 3 months to stretch out. It says 2 to 3 months your immunity, though you'll still be eligible 2 months after you had the last shot, but that is up to you. There's no recommended waiting period between getting COVID-19 vaccination and other vaccinations. I'll drop into the chat a resource that is hot off the presses from Superior Health Quality Alliance that talks about the flu vaccination and COVID-19 vaccinations. I wanted to remind you that Superior Health is still providing free vaccination education and are available to talk to you about in your facility about sustainability options for vaccination partners in your area. We may still have some free mobile vaccination clinics if you are in the Minnesota area. As for Wisconsin and Michigan, we are full to capacity for free mobile vaccination clinics. These will end about October 31st, 2024. So be sure to get your message into the immunizations at superiorhealthqa.org email. I'll drop that into the chat in a second. Next slide. Beginning September 30th, 2024, individuals are considered up to date if they've received a single dose of the 24-25 updated COVID-19 vaccination. Under this new recommendations, most individuals will not be up to date with COVID-19 vaccines until they receive the 24-25 updated vaccination. Facilities should report 0 up to date until individuals receive the 24-25 updated COVID-19 vaccinations. Updates to the surveillance up-to-date definition for NHSN can be found, and I'll put that in the chat next. And then new combined respiratory pathogens forms for residents beginning September 30th. Facilities will report respiratory pathogen vaccination case and hospitalization data on a newly combined reporting form. The pathway data reporting form for positive COVID-19 influenza and RSV cases will be retired and archived. COVID-19 vaccination case and hospitalization reporting are required, while flu and RSV reporting remain optional. Next slide. Vaccine compliance and best practices. Best practices for vaccine compliance is multi-vaccine consent form. It should be the norm. Obtaining during admission, remind families, residents, when clinic is, that they've already signed the consent forms for anybody that's new and being admitted. Otherwise, obtaining that multi-vaccine consent form one time. That way, when the clinic comes, you can automatically tell the families, yep, you've already signed this. We did this at such and such point in time. Billing challenges, there is the option for roster billing. I will drop a link into the chat, and on the next slide, there's a link for that as well. Roster bill is a way for you to submit multiple claims for COVID-19 flu, pneumococcal vaccinations. If you're enrolled as a mass immunization roster biller, you must use the roster billing. You can contact your MAC website to learn more about how setting it up. It's important to have a culture of vaccination and do it as the IDT leadership, because they will do and follow suit. Vision setting, what's your vaccination mission, knowledge and encouraging staff's efforts and building trust with them. Develop standard processes and guidance to assist with making it easier for the IP and your facility to vaccinate, and use data to guide your conversations with residents, families, and staff the same. And I will drop all of these links into the chat now. There is many. The next slide has all of those resources, as well as you can access them in the PDF. Thank you.
Thanks. And I just wanted to remind you, or maybe we are already, but are we recording?
Yes.
Okay, thank you. So thank you, Constance. And now over to Sharon. We look forward to hearing about your knowledge and experience with us today on promoting health equity.
Great. Thank you so much, Tabitha, on the great information, Constance. I'm always learning as it changes, it's good to get the hot off the presses information. So thank you. So I am from the Michigan Developmental Disabilities Institute at Wayne State University. My colleague, Tom Jankowski, is from the Institute on Gerontology at Wayne State University. We were hoping to co-present, but he had a conflict today. But we're going to tell you, I'll tell you a little bit about a project we're working on called Most Valuable Providers, and it's around promoting health equity. Next slide, please. So the learning objectives for today are that I hope at the end of today's session, you'll be able to describe the criteria to become a most valuable provider, or MVP, that you'll be able to describe the need for MVP and describe how MVP might be replicated in and outside of Michigan. Next slide, please. So before I get into my slides, I thought this video is a video that was created last year. Our project was selected by the American Public Health Association as part of their 2023 Thought Leadership Film Series. The video is 7 minutes, and it will allow me to kind of skim through quite a few of my slides, but we'll give you a nice overview, and I can tell you a little more detail and more updates. So if you could show the video.
People with disabilities are 6 times more likely to die from COVID-19 than those without disabilities. And people with disabilities experience other health disparities, including higher rates of diabetes, stroke, heart disease, cancer, and depression. And we know these disparities existed long before COVID, and they will persist if we don't do something about them now. The Michigan Developmental Disabilities Institute, or MyDDI, is the federally designated University Center of Excellence on Developmental Disabilities, or UCED, for the state of Michigan. And every state and U.S. territory has a UCED, and we make up a national network of 67 UCEDs. UCEDs serve as the bridge between the ivory tower of academia and the community, and we do that through training, community supports and services, research, and information dissemination. And our vision is healthy communities for all. And the way that we're going about this is we've created criteria to become a most valuable provider, or MVP certified. And this means that a site is accessible, sensory friendly, and welcoming to all people, including those with disabilities. Currently, we have 14 MVP certified sites across our state. We started with our champion, the Wayne Health Mobile Unit, who's been working with us and been MVP since the beginning.
As the first to become MVP certified, we really wanted to incorporate the ability to reach all patients. And so working with Sharon and MVP, we were able to revisit our current vans. We had 7 at the time, and really reimagine how those vans could be made fully accessible to all members of the community. But along the way, we always wanted to know what were people's challenges from a disability perspective and how we could address and help meet those challenges. So early on, we started asking about social determinants, things like food insecurity, housing insecurity, utilities. We even incorporated questions around voting assistance and legal needs, so that not only could we understand what the person coming to us needed, but we could also relay to funders and others involved in this ecosystem the need for addressing this specific population.
I first encountered the Wayne Health Mobile Unit at a community event. I got one of my COVID vaccines there. But to have that mobile unit there with the ramp deployed, available for seniors and individuals with disabilities, to know that they had a safe space with individuals that were concerned about their well-being. They felt like they belonged there because there was access created for them. So that's a beautiful thing.
People with disabilities have the fundamental right for the highest standard of health. And we're working toward this, continuing to develop and deliver training for healthcare professionals, to include disability as part of diversity, equity, and inclusion initiatives. And then finally, we cannot show how we are addressing reducing disparities if we don't have good baseline data on disability. So we are asking that disability status be consistently and systematically collected across sites.
Adults with disabilities are over 25% of the population in the U.S. It's too large of a demographic to continue overlooking, and there is not enough focus on this population when healthcare providers go through medical school. There also needs to be a more holistic approach to medicine and to healthcare. People with disabilities often feel like they're not seen as a whole person when they're receiving health care, because the tendency is to look at the immediate medical need. And we need to start counting disability through the data that we gather. When we don't count disability, we miss a huge part of the problem in non-disability specific issues such as health equity.
So we have over 40 staff at Detroit Health Department who are MVP trained on how we could better provide services and safe quality care to the population. So the sensory treatment room has been a very positive experience. Here at Detroit Health Department, it has provided us an opportunity to interact with the clients that have disabilities where they can feel comfortable and safe in our care.
The Autism Alliance of Michigan really emphasizes anything that's going to help blunt some of the sensory stimulus coming in. So having covers on the light fixtures is one thing. Looking at sound, using noise canceling headsets, or things like having available a chew toy or a pull toy for a child to interact with. So we really focus on paying attention to those sensory inputs. Smell is another one. You don't want strong cleaning products or staff coming in with a lot of perfume.
Having an environment that's warm, that's friendly, that's very patient and understanding to meet the needs of the clients, it's been very, very positive. I would highly encourage any and all other health departments in Michigan or throughout the country to go ahead and participate in a wonderful program like MVP.
We want to expand MVP certification across the state, getting all 45 local health departments MVP certified, as well as many healthcare systems as we can. And I see this as the beginning of a journey. We have a long way to go. This is the time to really forge partnerships and alliances to promote disability inclusion. And in part of that journey, please, I encourage you, get to know your USED in your state or territory. We are here to work with you and to be that bridge between academia and the community.
Thank you for showing that video. And the next few slides I'm gonna go through pretty quickly because they're covered in the video. And I do want this to be as interactive as possible. I don't know your protocol, but feel free to stop me if you have a question along the way. I'd rather kind of have this be more conversational than me just talking at you. So just to kind of highlight a few things from the video, I am from the Michigan Developmental Disabilities Institute, known as MyDDI. As said in the video, we are what's known as the University Center of Excellence on Developmental Disabilities, or USED, and we are the University Center of Excellence for the state of Michigan, and all USEDs are federally mandated by the Developmental Disabilities Act of 2000. And that's our lovely building on Wayne State's campus in Detroit, Michigan. And I know we have folks from several states. I'm just curious if anyone is, it's a little hard to see, but just for the quick hand raise, if you're from Michigan. Or I don't know if it shows.
Yeah, you can go ahead and use like a reaction, or you can put in
Yes.
the chat too. If
Yeah,
you
either one
are,
is fine.
what state you're from.
Yeah, what state you're from, because I'd like to know if you're not from Michigan too.
Lisa responded that she's from Michigan with thumbs up.
Oh, yes.
Harbor Springs.
Oh, that's helpful too, to know. And if you're not from Michigan too, I'd love to know where you're from.
Wayne is from Michigan.
A lot of Michigan.
Caitlin, Jeanette.
Sheboygan, Wisconsin. Okay.
Margaret, Nikki is
Michigan.
from Wisconsin. So several people from Michigan, actually.
Yeah. And I saw a couple from Wisconsin. The other folks want to say where they're from? Okay, that's good to know who's on the call. Next slide, please. So this is a map of that was shown in the video. This is the network of the University Centers of Excellence on Developmental Disabilities. And so every state and U.S. territory has one. So I believe in Wisconsin, it's at University of Wisconsin. In Madison is the USED there. There's Lens, and check it out for your state or U.S. territory. Well, probably not territories here, but your state. And all USEDs have the same purpose, which is to promote community inclusion and quality of life for people with disabilities and their families. So MyDDI in Michigan, we serve people with all types of disabilities across a lifespan. And I know this group is probably more focused on aging. We do a lot related to older adults. We work across the state of Michigan. Even though we're housed at Wayne State, we serve the entire state. We just had our 40th anniversary. I have a link to our video there. And I report up to our Office of the Yes. Next slide, please. So in the video, the most valuable providers MVP project was mentioned. And this is a collaboration, actually, a few.
This is a part of it, though. This is part of the connect. It's the notification.
Oh, I'm sorry. Is someone, if you could turn, keep on mute, and when you're not speaking, that'd be great. Okay. So the Michigan Developmental Disabilities Institute, a few years back, received a large grant through our Department of Health and Human Services in Michigan that was CDC COVID relief funds. It was through Supplement 4, which focused on health equity, and it was focusing on populations that had been disproportionately impacted by COVID-19. We know that includes people with disabilities. We know that includes older adults as well. And there were a couple other organizations that received this exact funding, which is, thank you for muting everyone, the Autism Alliance of Michigan and Disability Rights Michigan, which is the protection and advocacy agency for the state of Michigan. We decided to partner together. We figured we all had the same target population, same goals and objectives, and we wanted to be good stewards of our funding and had the greatest collective impact of our funding. And our vision is to create healthy communities for all. And to achieve this vision, we created criteria to become a most valuable provider. And that criteria, which I'll show you in a minute, is to offer vaccine and other health clinic experiences that are accessible and welcoming to all people. And we've been focusing in on Michigan, but we really want to get this spread across Michigan and outside of Michigan. Next slide, please. So why is this needed? In the video, I'll really breeze through this quickly, but we know that disability is common. 1 in 4 adults has a disability. People with disabilities have long experience health disparities, including pretty much any condition you can think of. People with disabilities have higher rates of those, higher depression, cancer, heart disease, etc. And people with disabilities, I mean, this one, that statistic of being 6 times more likely to die from COVID always stops me in my tracks. And we know that people with disabilities experience all kinds of barriers to accessing healthcare. Some are physical barriers and some are attitudinal barriers. And I'll talk a bit more about that in a moment. And we, as I said in the video, we know that if we don't do something about these disparities, they will persist. And part of that, as you'll hear in a moment, is really elevating disability, the collection of disability status and knowing disability status to ask in the same way you would ask other types of socio-demographic variables, whether it's age, race, sex, etc. Next slide. So here are the criteria. And again, please stop me if you have questions as I go along. We have 4 criteria to become an MVP site. And I'll tell you, my next slide, I think, shows, will tell you a little bit more about who our MVP sites are now. But we have developed a training. It's focused on healthcare providers. And it's I would call it a disability awareness, kind of disability 101 training that it's 90 minutes long. It's recorded. It can be watched at one's own pace. It can be watched as a group and as a lunch and learn. We do offer free continuing medical education credits and continuing education credits for a wide range of disciplines. We're looking to grow this as well, but, and it's free. So, and our hope is that the types of things that are covered in the training would just improve clinical care just more broadly and not just for people with disabilities. As an example, having good communication techniques. You don't have to have a disability to want to be treated respectfully, to be have your provider introduce themselves, things along those lines. We ask that, oh, and just to note, the link to the training is here. It's free, and even if through this, as I tell you about MVP, if no one was interested in becoming MVP certified or learning more, the training is free, and the CEUs are free. We ask that the site be accessible. And here we're focusing primarily on physical accessibility. And in Michigan, we ask that the site complete a consultation with the Disability Rights Michigan to discuss best practices. Outside of Michigan, and even now within Michigan, we're looking to change this. We have a document that is just some things, some best practices around accessibility, and that document be reviewed. And then we've created a checklist, which I'll show you in a moment, of what that would look like. I think it might be the next slide. If it is, I'll show you that real quick. I'm not sure if that's the next slide or not. Nope, we'll go back. I'll show it after. But we do have a checklist on how to be MVP or how to be physically accessible. And then that the site complete a consultation, again, if in Michigan, with the Autism Alliance of Michigan. If outside of Michigan, I'll tell you a bit about that in a moment. But to explore sensory-friendly strategies. Some of our sites have created, as was shown in the video with the Detroit Health Department, sensory-friendly treatment rooms. It's not required, but that is something that we can help with. And with the sensory-friendly considerations, again, it's not just for people with disabilities. You don't have to have a disability to, people have anxieties, particularly around getting vaccines. And to go into an environment that's chaotic or loud noises, loud sounds, bright lights, fluorescent lights. Very few people really enjoy that kind of setting, including the staff. So, just some considerations to make it a more soothing environment. And then finally, we ask that disability data be collected. On the next slide, I do show there are 6 behavioral risk factor surveillance survey questions that are used in Michigan through the Michigan Department of Health and Human Services. The same questions that are asked by the American Community Survey that are sort of the gold standard of asking disability. And these include 6 areas of functioning around hearing, vision, cognition, mobility, independent living, and in basically independent activities of daily living. And if someone answers yes to any one of these questions, they're considered to have a disability. For some of our sites, they have found that adding 6 questions to their medical record is too cumbersome. In those cases, we've allowed sites to ask simply, do you identify as having a disability, or do you have a disability? You can kind of tweak the wording a little bit. And then if you just go back up one to the previous slide, I just want to mention that when these criteria are met, also related to disability status, if someone says, yes, I have a disability, we ask that accommodation, the patient be asked if they have any accommodations. And then once the site meets these criteria, then they get the MVP designation. We provide our shield, that's our logo. We provide kind of MVP swag and materials that can be shared. And we also list the site on our webpage to indicate, we're trying to build this brand of come to our clinic, come to our nursing home, wherever this site, come to our organization, you're going to get great care. Your family members are going to get great care. And really for everybody, whoever walks through that door is going to get great care. Next slide. And then the one after that. So in the video, I think we were at 14 MVP sites. We're up to 23. A little over half of them are local health departments. We have some healthcare organizations. We have 1 mental health clinic, and we have 2 dental clinics included. Oh, and 3 mobile units. Pictured here is the Wayne Health mobile unit, which was featured in the video, which has a fleet of 7 vehicles. And then we have 2 other mobile health clinics. We've trained over 1,000 healthcare professionals. We've seen since July of 2022, we've seen over 85,000 patients and given over 55,000 vaccines. And our next steps are to expand the number of MVP sites in Michigan and nationally. And then also our big focus of ours is really looking at, looking at the work that we partner with our colleagues at Institute on Gerontology, and so much of what the disability-friendly, sensory-friendly aspects of MVP really address a lot of the characteristics that you would expect for a site to be age-friendly. We are building that out a bit by really looking at, is there anything that we haven't covered in our materials, in our approach, that would make it even more age-friendly? So we're adding a component, we're building a training to supplement the designation of MVP so that it would recognize the site as being disability-friendly, sensory-friendly, and age-friendly. And then we're also looking at people don't, have just one thing that they are. People with disabilities are many things. All of us are many things. So we're trying to look at intersectional identities, whether it be disability and aging, disability and race, age and race. There's a lot of combinations that you could have there. And really looking at how approaches that use universal design techniques can really take care of the needs of really anyone who walks through the door. That's the one nice piece about when you try and make interventions for people with disabilities. Ramps, are a perfect example. They don't just provide assistance and support to people who use wheelchairs, but it could be someone pushing a stroller, someone who has broken their leg, whatever it might be with a temporary disability. So that is the emphasis that we have right now. Next slide. So I just wanted to mention again, please, if you're not from Michigan, if you're from Michigan, please reach out to me if you have any questions on disability or want to learn more. Outside of Michigan, if you go to the link at the bottom of the slide, you can find whether it's Wisconsin, Illinois, Minnesota. I can't remember all the states that you cover. I know you're Midwest states. Ohio as well. Can't remember all the states.
Not in this scope of work. It's Wisconsin, Michigan, and Minnesota. In the next scope of work, if we win it, it would be Wisconsin, Michigan, Minnesota, Ohio, Indiana, and Illinois for that region.
Wonderful.
So
excellent.
The region is a little different.
Yeah, and the network, this national network, also has regional networks, and those states you mentioned, the expanded group, is the exact region that Michigan is in. So we do a lot of work together, and it's so important. So that's exciting to hear. So I just encourage you, Wisconsin, Minnesota folks, to also learn more about your USEDs. Next slide. So replicating, any questions? I don't know if there's any in the chat, anything before I kind of talk about what it might mean to replicate MVP. Because especially if you're outside of Michigan, the other part I didn't mention is that we have our funding. We just today found out, or late last night, found out that we're able to extend, our funding was supposed to end September 30th of 2024. We're able to extend it with a no cost extension through June 30th, 2025. So we still have funding to onboard organizations. So that is something that if you're interested, we could probably talk. I think it would need to be just the Michigan group, but in any case, I want to say that to replicate this, it requires that the front-facing staff complete the disability awareness training. Link is there, it's free, and the CMEs are free. One of the things that we're working on going forward, and my DDI is committed as part of our mission to continue to offer free CME, CEUs going forward. And we're also growing the trainings that we offer, and we'll offer those with free CMEs because it's so important to get, knowledge is power. And I didn't say this, but there's sadly, considerable research showing the biases that healthcare providers have toward people with disabilities. And I'm sure, towards older adults too. And part of that is that there's research showing that healthcare providers have opinions that people with disabilities have a lower quality of life. So you can imagine the kind of care that might be given or not given if someone's viewed to have a lower quality of life. Same with an older adult. And if you recall at the beginning of COVID, and this is, before vaccines came out, and even when they first came out, rationing of services, and who's going to get those services, and there are people that are overlooked in getting those services or excluded from getting a higher priority. So it's very important to overcome those attitudinal barriers. I'm off my soapbox now and on to the next one. This is the, if you go back up, I'm sorry, Ted. For the accessibility, this is the document I mentioned. This is a link to the Michigan Department of Health and Human Services guidelines and best practices for accessibility at Michigan vaccine sites. But these criteria and guidelines are really based on what's expected nationally and Section 504. So this you could take Michigan out and put Minnesota, Wisconsin, any state really, and it would have the same kinds of considerations. So we ask that a site review that document. And the next slide here is where I have what the criteria are. And this is a list of, sort of what my colleagues at Disability Rights Michigan distilled as kind of the minimum criteria that would need to be met to get the seal of approval. And you can see it's largely around physical accessibility signage, allowing of service animals, and some assistance at registration and some communication. And then also just in the previous slide, I do have a link. Every state in US territory also has a protection and advocacy organization. So if you are interested in learning yours, in Michigan, it's Disability Rights Michigan. In Wisconsin and Minnesota, if you want to know who yours is, the link is there. So now you can go forward 2 slides. Okay, for the sensory-friendly piece, we are creating a sensory-friendly checklist and hopefully a brief video to go with it. That's what we're going to be developing. If you're in Michigan, you can get a free consultation with the Autism Alliance of Michigan. And, if you're really interested and you're outside of Michigan, I could see if I could swing something. So don't be deterred. I really want to get this spread. I'd love to get this spread outside of Michigan. I think it's, we hope it's just a really good starting point, a good model to work with to best serve all kinds of, really anybody who walks through the door. And then if you're outside of Michigan, I listed a link there for some resources, national resources and other statewide resources. And then finally, that we ask that disability status be asked and that accommodations be asked. And this would be either asking those 6 American Community Survey questions that were on the earlier slide, or asking 1 disability question and asking accommodation needs. And we're working on creating a brief checklist here. Okay, next slides. So this is really the part that I would love to hear from you. What questions you have, what additional information, even just getting a sense of like what your interest in this, the barriers you think that might exist, what, just the questions that are listed here. What additional information would you need? What changes would be needed? And how can I help you? So I'll start with just kind of like general interest.
Feel free to unmute or put it in the chat box. You could also use a reaction of thumbs up if you're interested as well. Sorry, I'm looking.
I don't see any reactions. But while we're waiting for people to kind of unmute or chime in, while listening to you, Sharon, I was wondering if anybody on the call either already does some sort of disability training or has partnered with any other organizations that highlights disability training for their staff or their leaders, or how this might intersect with DEI initiatives that your organization might have. Does anybody have experience with any of those things? No, I'm not seeing any responses.
So is disability just not on the radar, or is it? Yeah, I'm just curious about that, because one of the things that we do want to do in terms of, and I know a lot of organizations, some organizations are sort of getting, there's pushback on DEI efforts, and some really pride themselves on that. So I'm not sure, and it can vary within pockets, within states and areas. I know in Michigan, there are pockets that are very averse to doing anything DEI. And I just saw a commercial yesterday morning, a politician saying, if I'm elected, there'll be no DEI, end to DEI, and other places where, that's a point of pride. And then, so that can be one issue, just equity and diversity. And then is disability, a lot of people don't think about disability when they think of DEI.
Mhm.
I know that equity and diversity is a big thing that CMS is looking for. We ask in our vaccination education and questionnaires, we ask about if equity is an issue with vaccines and administration in your facility when we're talking with facilities. So it is a big initiative from CMS's standpoint to be inclusive, to have conversations about that. I know there are several different groups that have reached out about, in Wisconsin at least, from the Wisconsin DON Council, about things that they can include to help with policies for LGBTQIA people. So I know that it's a priority. It's just a super quiet group.
Yeah, and
Lisa
Lisa,
said sorry, go ahead.
look, I was just gonna say, Lisa said exactly what I was thinking in my head, being that skilled nursing facilities, the training is not specific to disability that they provide to their staff. However, all of the residents, or I would say probably most of the residents have a disability in some way. That's why they qualify for skilled nursing care usually, right? And it is inherent in what they do as far as caregiving goes. So it's less prominent in staff training, but vaccine access for us has not been an issue as it relates to access with those with disabilities. So that's a good thing, right? That they're not having barriers. But I was thinking the same thing. Like most or all residents would probably qualify as having a disability based on those questions that you had on your questionnaire, Sharon. And then also, I always think about, you were really highlighting the physical access for people with disabilities or limited mobility. And I always think about those nursing home facilities that are trying their best and work really hard with those older buildings, the narrow doorways and the small bathrooms. And I always think about that, on how hard that must be, because it takes a lot of money, right, to do large renovations to create accessibility sometimes. So what insights or information would you have to share with the leaders on the call that might be having some barriers related to that?
Absolutely. And that is, we, this is something that we've been grappling with because, we want, there are many places, a lot of the health departments are in old buildings, and some of the, organizations are in older buildings. I would say that there is the ADA, the Americans with Disabilities Act, that requires a certain level of, compliance. So I'm hoping and I'm assuming those requirements are met by having, if you're licensed, but I would encourage you, I had the slide about the protection and advocacy agencies in your state, and that particular, every state in U.S. territory has a university center such as mine, a protection and advocacy agency, and a developmental disabilities council. And we work as a network, and the protection and advocacy group would be the most helpful in terms of resources, strategies on the changes of the physical accessibility of the site. And I think that, going back to it's a really good point about that many of you, if it's a skilled nursing facility, that those by nature, that the probably 100% have a disability based on the questions that were listed. But I do think that there are things within the training that, and even I know for myself, and I've been in the disability field for a long time, when I do a disability awareness training, if it's by someone else, I always learn something new. And I think that it's really important just to be mindful that, a lot of us carry certain biases with us, and I think even, let's say, if there's things related to dementia or, the things that could be helpful by having training, although I'm sure many of you have gone through that kind of training. But I do think that just being mindful of disability, some people may have had lifelong disabilities that may, that they've lived with their whole life, and it may not be age related. So just like to kind of parse it out instead of it just being one big, generic identity. There's a lot of nuance and a lot of things and a lot of strategies of just to get to know someone better. I don't know if I answered your question about the physical accessibility. And I'm just hoping that, by nature of the ADA and being compliant with that the sites are largely that. But, our bare minimum is that a site, an organization have facilities where the hallways are wide enough to accommodate someone who uses a wheelchair. They have restrooms that can, that someone can use for a wheelchair. It's largely for wheelchair users. It's not limited to that. But even knowing if your site isn't, maybe there's some limitations, it's not perfect, then knowing, Mr. Jones uses a wheelchair, I'm going to be mindful that when he's in this part of the facility, we're going to provide some assistance, even just raising the awareness of that. And then it might be, you know what, this is a big problem, we need to change this. Like we've had some of the sites that didn't have automatic doors. We offered some small funding, and some sites used it to get an automatic door. Everyone had a ramp, but
do you think it's helpful sorry to interrupt. Do you think it's helpful to be an MVP certified to help reduce staff turnover, burnout, and things like that by being more proactive and having more education with disabilities, that it helps to reduce frustrations with residents that might be?
Yes. And we have been hearing that feedback of that it's been helpful to the staff to know, even just asking or having techniques, having, shared communication, that could be something like as a lunch and learn to do together. And we're growing the trainings that we offer. But I do think it sort of allows you to anticipate things. It allows for better clinical care, independent of disability. Because not everybody has the same disability or the same needs, but just by being mindful, communication techniques that can be used, strategies that can be used, I think it just goes such a long way. And as we build it out, by using universal design approaches, it could be helpful for other aspects of diversity and equity. Like you said, LGBTQ, people can have a disability, be elderly, and be gay or transgender or whatever that might be, or a person who's African American, whatever that might be. English isn't their first language, so it just allows for overall we're working on building out more and more universal design, so that or things that we do for people with, with some cognitive issues, having plain language versions of materials, things that can be shared, large script, where it can be read to somebody, all the things that also can happen just with aging, speaking personally with a hearing and vision, as you get older, those things can change. So I do think our aim is to really improve clinical care for everyone, and by addressing kind of what approaches tend to be helpful to most people.
Yeah, that's great. I also think that it's important to remember that disabilities aren't always what you can see. And I think that we're going to see larger populations of younger people that do have disabilities and need assistance. And I think it's good to examine those unconscious biases that we all have in that process. So I would encourage, I know Elena just said that I took the training several months ago and really appreciated it, especially the personal stories that people living with disabilities were willing to share. So we obviously think it's very valuable to organizations to consider these things. And like you said, they might not, as a facility person, I had previously not always examined every single spot of my facility to see where disabilities might have trouble accessing or whatnot in that mindset. So it can give you a different perspective as well.
And I think that just by going through the process, and thank you for mentioning it, and thanks for the plug on the training, Elena. But it's like the whole process of becoming MVP certified is to increase awareness. And it's sort of a shared experience. So I don't know if you can go as far as say it's team building, but it shows that the organization values people with different needs and respects people with different needs and addresses the needs of people of diverse populations. And by even just reviewing how is our site around accessibility? Where are some of our, what are our strengths? What are our weaknesses? What can we do? Where's kind of the low hanging fruit, whether it's a physical change? I think the sensory friendly piece is a big one too, because people don't always think about like, where are our noisy areas? Where's our lighting horrible? Where, do staff come in wearing really heavy perfumes? Things like that can kind of throw people off or be, just things to keep in mind, or cleaning products. So just to make improvements, and they're not, a lot of the changes that our organizations have made have been free or, low cost free just by becoming aware. And then there can be things, we had one site that decided, that they were going to create, for gynecological services in a more accessible space. And this is a different age population, but it could be for any population. So, but they decided that's an area where we really are lacking, and we're going to spend some resources there. You don't have to, but it increases the awareness, even asking disability status, and then accommodation needs. I mean, I don't know how quite that, I'm thinking a lot of what we've been talking about is people going to a place for an appointment, but there could be things that might just, by being mindful of it, you could build into the person's care plan or however you do it at your organization to be mindful of, this could help assist that person by, and being aware of that.
Thank you. Thank you so much, Sharon. We are getting to the end here of our time. So I just wanted to allow for a little bit of time if there's anybody else that wants to speak up or ask any questions. And just remind everybody that we do have our next and last presentation on October 23rd at 12 p.m. Central. And we will continue this series on turning deficiencies into efficiencies. The topic will be on enhanced barrier precautions presented by our very own Constance Tetrov, who's here today. So we're excited to wrap up our series and our roundtable events with her. Thank you again for participating. Thank you, Sharon, for speaking and enlightening us all on this network and resources that exist. And lastly, there is a poll that Constance put up. So if you could take a few seconds to complete that, it's related to some questions around your EHR. And if you're using point click care, we're just looking for some information to provide some targeted approaches. So if you could take a second, it's 4 questions. Takes just a couple of seconds. We would appreciate your response.
If you are using Performance Insights or the module that talks about hospital rehospitalization and you're interested in being a speaker, please email the Roundtable or the Immunizations email at immunizations@superiorhealthqa.org or the Roundtable email, which is roundtable@superiorhealthqa.org. We're just looking for a facility that's using that module that's reducing hospitalizations and feels successful in it. So thank you, everyone.